After having been trained as a classical MD, I felt very empowered with the knowledge on how to treat many conditions as a primary care physician. And so patients started coming to me, and I felt that I would have the right education and the right tools to really help them get back to a better quality of life. I think that's what we all kind of went into this field for. What I realized over the course of the next few years after residency was that many times I was spending time diagnosing issues and then giving out prescriptions that patients may not be so excited about. So, for instance, in a patient who might have menstrual migraines, they're able to almost self-diagnose these days with the help of many search engines. So they come to you very informed. They almost know the medication you're going to put them on, but they're already prepared to say, but I don't want to be on this kind of medication. Can you tell me what the cause of my migraines are? And at that time, when I didn't have functional medicine training, my answer was, well, this is just because you're cycling with your hormones, and we can maybe put you on some birth control pills to alter your cycles, or potentially give you these medications that help address your migraine pain, because we all know that people with migraines can have very debilitating headaches that really affect their quality of life, their productivity in society. So it really felt a little bit disengaging to the patient, I would assume, that they come to you really looking for something to solve the problem as opposed to just patch it whenever it flares. So after having done functional medicine and understanding a bit more about hormone physiology, and I say a bit more to be a little bit understated, so I understand a lot more about physiology. And again, the gap between normal physiology and when things start to dysfunction and cause problems. I learned that estrogen is primarily eliminated through the bowels, and that if someone suffers from constipation, which, by the way, people don't admit unless you ask them, if you are able to ask the question about somebody's bowel patterns when they have menstrual migraines, many times you'll find that they have a long-standing history of constipation. So if I'm able to address the constipation, whether it is to figure out if they have a food sensitivity or allergy, or if they're not drinking enough water, they're not exercising as much, they need more fiber, et cetera, and I get them to eliminate their estrogen appropriately, then they don't have this situation called estrogen dominance, which is when you have too much estradiol compared to your other hormones. So this now starts to make sense. Right before a woman has her periods, her estrogen levels may be higher than her progesterone levels, because we know the few days prior your progesterone levels drop. So if this woman is in a state of estrogen dominance, this will create the frequency of migraines or the intensity of migraines in a genetically susceptible woman. So there you have it. Someone who used to suffer from migraines can come to see a functional medicine provider after doing a good understanding of their timeline and matrix. You may determine that it could be all about their bowel movements. Fix their bowel movements, correct the hormones, and now they don't have to use as many Band-Aids.